Hi, everyone. I'm on Gadigal land, and I acknowledge this land was never ceded. So Ruth and I will share this brief presentation, and I think, Ruth, we're happy if there's something that anyone wants to clarify or have a bit of a bit of clarity over as we go through. Please do, but we'd also very much like a bit of a discussion at the end, because right at the end, Ruth will present to you some of the ways in which this work is currently being used and what further possibilities there are. So knowing that this is a kind of a work in progress meeting, that's what we really enjoy. Next slide. Everyone on this call, I'm absolutely certain, is fully aware of the hyperincarceration in Australia, in many places, but particularly in Australia, of groups of people, First Nations people, those with mental and cognitive disability, those who have AOD issues, and those who are homeless. And that's just a kind of a snapshot of the particular hyperincarceration. By hyperincarceration, we mean that this is not mass incarceration. Australia does not have mass incarceration because non-First Nations and people who don't fall into these categories are nowhere near being overrepresented in criminal legal processes in Australia, whereas these groups are. I'm sure you're thoroughly aware of the rates, the very high rates of First Nations people. And work that we have done over a long time, Ruth's been involved with me from very early on in this work, is trying to understand why that hyperincarceration happens, what is going on. And we came to a point about 5 years ago where, out of all of the work we'd been doing, it became pretty clear that there were some clear social factors. We all know that, but we needed a framework in which to work on that. Next. Ruth? Yeah, thank you. So the social determinants of health became a really obvious framework in which to develop our work. So just to remind everybody that the social determinants of health inequalities or inequities, Sir Michael Marmot is the key lead on that and has been for the last 25 years. It's a very well-established structural theoretical framework, and I'm certain that you're all well aware of it. And the UN adopted it a long time ago to help explain why certain groups of people had very poor, significantly poorer outcomes than others in the same society. So this is the kind of framework that we are working with. So next slide, to bring us into thinking about how we apply it in criminal legal processes, what's called criminal justice. So we have a very long history of some absolutely luminous people, including Professor Tony Vinson, very sadly died in 2017. But Tony Vinson's 50 years of work on looking at the unequal access to things, and his first one called Unequal in Life, with many others following that. Ross Hommel's work on children's pathways and longitudinal data, showing the ways in which particular facets or factors affect people's life courses, particularly in regard in our interest, particularly in regard to justice. And of course, Stuart's work on longitudinal prisoner, post-prisoner health that he's been doing for the last 20 years now, at least, I think. And what we then were able to pull together was this background giving us a sense that there is a theoretical framework we can build. And we applied it to the life course pathway data that I'd been leading since 2007 around a group of people, a cohort of people in New South Wales. And we have so much of their data and all of these touch points, so to speak, that we thought that it would be a really great idea to apply a social determinants approach to explain the inequities in criminal justice. And it'll be no surprise to you once we get a little further down the track that this is very closely connected with, integrated with the social determinants of health. Next slide. So just a bit of quick background. Many of you may already know some of this work, but the mental health disability, cognitive disability, is a linked administrative, it's now a data bank. We started it back in 2007, where we were able to get from every agency in New South Wales that had the data, we were able to get a very large data bank, not for a large number of people, 2,731 isn't that many people, but we got all of their data from the beginning of where we see this group of people in the data, whether that's in police or housing or education, wherever we first see it. Health is often early. Wherever we first see it, we have every event that those people have experienced up until the time we drew the data. We are in process of updating it, which is not an easy task, but we already had enough over decades, actually, for most of the people, not all of them, but most of them. All of those people have been in prison in New South Wales. And so that is the base for what we're doing, rather than taking, you know, millions of people's data and searching through it to find people who had been criminalised and ended up in prison, and particularly the groups we're interested in, the mental health disorder cognitive disability group. We did it the other way around. So we got a cohort, all of whom had been in prison. So it is a selective, of course, data. So we're not talking about proving numbers. We're not talking about proving general overrepresentation or anything like that. But what we have is clear pathway data for these people. And it allows us to see the contact that each of these people, because although they're de-identified, we have the data that is linked to each of them. So it's a relational data bank, a database that we use. And as I say, it's now been created into a data bank. So this longitudinal work allows us to look at over time and across time all of the things that we are looking for in terms of their significance in someone's life. So out-of-home care, police incidents, hospital, etc., and of course, time in custody. Next slide, thanks. So the meta-analyses of the many studies that we've undertaken over the last I don't know, what is it now, 17 years or 16 years. We have, these are just a very small number of the papers and the analyses that we've done. The reason we're just highlighting these is that this shows our progression in a way, the way in which our thinking has developed. Very early on, we began to recognise that cumulative and compounding disadvantage factors were appearing consistently for this group of people, because we could see all of the factors that were occurring in their lives at certain points in their lives. We're also able to analyse what was going on in regard to costs, for example, because we had all of those events, and we just added up all the events, the thousands of events for many people. There were many thousand, and costed them. So that is another aspect of thinking about the way in which this cumulative and compounding nature of disadvantage that occurs for these groups of people, but this group in particular. We got another ARC, which was then a follow-up for Indigenous Australians with mental and cognitive disability and criminal justice. And that enabled us not only to do further analysis of that quantitative data bank, but it also enabled us to go to communities, Aboriginal communities, that said they wanted to be involved in this. And Ruth will give you a little bit of a background on that in a minute or two, because the Honorary work, that the partnership that she leads at the UNSW end, is an immediate outcome of that particular ARC. And it is a partnership with Aboriginal elders in Walgett. So this, I hope, gives everyone a bit of a sense or a background to the data that we're using, the framework that we're using, and how we then began to arrive at using a social determinants framework. So I'll hand over to Ruth to continue.
Thank you. And yes, I'm joining from Gadigal country today and pay respect to elders past and present here, and also the elders of all the unceded country that you're joining from. As Eileen mentioned, we did a kind of a meta-analysis of a number of studies that were things like the geographic distribution of this particular cohort that we've got the detailed data on, and other elements in terms of different experiences for those who've been in out-of-home care, etc. So we did a bit of a meta-analysis of those studies, drawing on the data bank, and then identified the factors in those in that analysis that had a significant association with initial and then repeated contact with New South Wales criminal legal agencies for those in this cohort. And so I imagine that these none of these will surprise those of you involved in this kind of research, but I guess we felt using administrative data, government's own data, when part of the intention, I guess, is to think about policy differently. And, the discussion, which is an ongoing one around things like reinvesting differently in early intervention, prevention, etc. So we were thinking about actually using the kind of all of the linked data for that particular kind of purpose to better understand those factors. So the social determinants of justice, as we've kind of conceptualised them, are those listed here. So out-of-home care. So the proportion of people in the cohort who were in out-of-home care at some point in their childhood, significantly higher than for the general population. And those in this cohort, in the data bank overall, who'd been in out-of-home care had significantly higher levels of contact with criminal legal agencies than those who'd not. So there's in the kind of longer article that was published on this, which we can share, we've got a bit more detail around the kind of percentages around that, but that was a very clear factor or determinant in the way that we are kind of conceiving of it. Poor school education. So although we know the prison population has generally low levels of education, people in this data bank had even lower levels of education recorded. And those with cognitive disability, in combination with any other diagnosis, had extremely poor attainments, with the majority, more than 80%, either completing primary school only or leaving school without any qualifications. Being Indigenous in and of itself was a determinant. So Indigenous people in the cohort were significantly more likely to have experienced earlier and greater contact with criminal legal agencies and greater disadvantage than non-Indigenous people in the cohort. As Eileen said, there's been some significant analysis of the Indigenous people in the cohort, or about a quarter of that number. So they were significantly more likely to have been in out-of-home care, to have come into contact with police at a younger age and a higher rate. And that was both as a victim and offender. And so I guess in this kind of analysis, we are particularly looking at the social determinants of justice for those who themselves have been, all of this cohort were incarcerated, but almost all of them had been victims before they were considered, offenders or perpetrators in the system. So their police data, for example, shows that almost all of them had been identified as a victim first or as a child at risk. Early contact with police was in and of itself a determinant. So analysis of both the kind of quantitative elements of the administrative data, but also the kind of qualitative elements, the police case notes that were incredibly detailed. You could see that children with a disability in particular in the cohort, who were characterised as having kind of challenging behaviours from an early age, were frequently left to be managed. We use that term obviously we can conceive of very different ways to describe that, but managed certainly by police. So often police would note in their files that a child with complex support needs was at risk, but that would soon shift to being a risk. And you could see that language shift in the notes of police. So we could see that early police contact in and of itself was a determinant. Certainly, as Eileen mentioned, unsupported cognitive disability and mental health issues was definitely a determinant. So people with multiple diagnoses of mental health disorders and cognitive disability were significantly more likely than their peers without complex support needs. So those multiple diagnoses, they were significantly more likely to have had earlier contact with police, more early police episodes, but more likely to have ended up in contact with youth justice agencies, have more police episodes than throughout their life, and also experience more prison episodes than those with a single diagnosis or no diagnosis. There was a small number in the cohort without a formal diagnosis. Problematic alcohol and other drug use. So almost half of the cohort had at some point received a diagnosis of substance abuse disorder recorded in their files. The average age at first police contact for those in the cohort with multiple diagnoses, including substance use disorder, was significantly lower than those, again, with single or no diagnosis. Experiencing homelessness or unstable housing. So high numbers of people in the cohort recorded as having no fixed permanent address at different points in their lives, including as children and young people. So people with cognitive disability in contact with criminal legal agencies were very likely to have been homeless or marginally housed. And Indigenous people with cognitive disability were even more likely to have experienced homelessness, unstable housing, and frequent changes of address than non-Indigenous people. Disadvantaged location, coming from or living in, we had all that postcode data. So the majority came from, in the cohort, came from, returned to and lived in a very small number of suburbs and towns. And as Eileen mentioned, this is consistent with Tony Vincent and other analysis in this area around the kind of concentration of disadvantage across the country. And they were predominantly areas containing clusters of public and community housing. So, for example, one fairly startling figure is that a quarter of the cohort was accounted for by just three towns and suburbs in New South Wales, which is pretty extraordinary. And they're the places lacking services, lacking infrastructure that are sorely needed in terms of appropriately responding to the disadvantage experienced by so many of the people living there. And so what we also found in our analysis is that the more of these factors you experience, the more likely you are to be incarcerated and reincarcerated. So as Eileen mentioned, that kind of compounding element was really stark through this analysis. So what we did was then look at those as kind of conceptualised as the kind of initial social determinants of justice. But obviously, those factors in and of themselves don't determine the particular outcomes that we were seeing. And so I suppose, sorry, just briefly stop the share. Just put my elbow on the keyboard. What we can see there is that really the factors that we're kind of needing to look at is the causes of the causes, or what I guess in the social determinants of health, there's really important work that's been done from the early days where there was a broad literature review of a whole lot of work around the social determinants of justice. And Michael Marmont and others saying, well, it's not just those kind of factors, which is in our case with this kind of list. They in of themselves don't determine that kind of hyper-incarceration in terms of particular groups. And from the social determinants of justice, we could kind of see the work around the structural factors that had been done, which Michael Marmont called, as I said, the causes of the criminalisation and incarceration of specific groups. So I guess what we then sought to do was to kind of combine that work from the social determinants of health, so those structural factors, and look at a whole lot of other research in the area to think about what they are in this kind of context. And really they are the entrenchment of poverty and unequal access to resources in families and neighbourhoods, the kind of structural racism and discrimination, in particular experienced by Aboriginal communities and people with disability, and the kind of failure to adequately respond to abuse and violence and the trauma experienced by so many children and young people. And I guess what we also saw, and again, this is detailed in greater explication in our article, there is an element which we really identified as the operation of the criminal legal system itself. So the way that is a kind of determinant of criminalisation and incarceration in the way that it functions. So in the same way in the social determinants of health, that the health system was kind of identified as a determinant in this analysis that had been done by Michael Marmont and other colleagues, including Solar and Irwin, whose work we've drawn on significantly on the social determinants of health. So too is the way that the constituent agencies of police, of courts, of youth justice and corrections function to embed and exacerbate inequities. You know, for example, the over-surveillance by police, the lack of access to well-resourced legal representation, not being granted diversionary options and bail, the lack of specialist services and support, all of them mediate the differential likelihood and consequences of justice contact. And as I mentioned earlier, this is the case for both victims and perpetrators. So we've kind of spent, we spent a lot of time on this, didn't we, Eileen, kind of trying to come up with a pithy diagram, which is still pretty detailed, as you can kind of see. But I guess we borrowed from infographics around the social determinants of justice that were sort of placing individuals and certainly family at the heart of that, at the context in terms of those factors, where so often, I suppose, ideas about individual behaviour or peers or family are seen as the kind of risk factors for reoffending. You know, we really wanted to kind of challenge some of that, because we can kind of see that while there has been commitment to reducing reoffending, that there's certainly been a focus on diversionary initiatives, that really we're not seeing a shift in the hyper-incarceration of certain groups. And so that's where I suppose these kind of social, economic and environmental political factors, and then from those, the kind of structural drivers of those, it was worth trying to encapsulate those in this way. And so I guess part of our thinking around what this work does is it's able to kind of highlight some of the limitations around current policy approaches and resourcing. So that sort of focus around risk measurement tools, the LSIR and others, that really look at individual behaviour change as the primary focus or lever for change, really been quite limited when you can look at all the social determinants and their impact. And I guess the sort of siloed approach, which many of us working in this area talk about, and certainly we hear a lot about those working in services or frontline organisations. So, for example, drug and alcohol programs not being accessible if you've got a cognitive disability or mental health kind of programs not accepting people who might have drug and alcohol issues, etc. I'm sure you all have countless examples of that from the work that you're involved with. But we felt like this is a way to kind of explain at a structural level why those kind of approaches are really limited if we're serious about trying to reduce incarceration, particularly of these groups. And also where you're kind of setting up some programs and services to fail. If, you know, one of the things we can kind of see, particularly, I suppose, housing, and this is a very live discussion across the country at the moment, but if you've got programs and services that aren't really able to address people's experience of homelessness or are not, there's not a kind of targeted approach around disability or understanding about the particular needs and experiences of people with cognitive disability, if we're not taking holistic and a trauma-informed approach, given all of the kind of detail in that analysis, and we're not genuinely equipping community-led solutions, then you can see that there's kind of real limitations in the impact of a lot of current policy in New South Wales, but I presume in other jurisdictions too. So the application, I suppose, we published our initial article and a piece in The Conversation now kind of a little over a year ago. And I guess we had conceived of quite a few different ways that this work could be applied and could be useful. And certainly our early sense of its value could be around informing policy, as I mentioned, to kind of ensure that police are not the frontline service for people in crisis. So Walgett, which is the community with whom I work really closely, as an example, there are 40 police stationed in that town, and the population's a little over 2,000. So there's this extraordinary level of over-policing that happens, and that then has this kind of effect where the crime rates are seen as very high, so we need more police, rather than actually looking at the detail of what people are being arrested for. And so much of it is about crimes connected to poverty and disadvantage, driver licensing kind of issues, lots of kids getting fines for not riding without a bike helmet, for example. And then if fines aren't paid, that exacerbating effect there. We also felt that this could be a useful framework around recognising the value of Aboriginal community-controlled organisations who do often do much more community-focused, culturally led, but also holistic work. Again, a kind of case management model for people at risk of contact with the criminal legal system. And Eileen and I both at times served on the board of CRC, the Community Restorative Centre in New South Wales, that does provide this really fantastic holistic kind of model that's not just narrowly thinking about supporting people leaving custody in terms of offending behaviour, but meeting them where they're at in terms of all of their needs. And this, Eileen, I don't know if you want to speak a little bit to this, but we've been I'm obviously involved in the work in Walgett around place-based approaches, but this kind of concept of proportionate universalism is one that Eileen's been thinking about in more detail recently. Eileen, did you want to talk about that?
Yeah, so proportionate universalism is what it sounds like. And I've been doing a bit of this work. Ross Hommel is probably one of the lead people in this area for young people and youth, looking at the importance of universal provision, like our school education is universally provided in a country like Australia. But there are particular groups of children, for example, who need extra support. So we're talking about equity. So the equity needs are really important, and they show up consistently in the cohorts that we see in our data, and in the groups of people that Ruth and the Dariwa elders are concerned about, and trying to put services around them that are appropriate, that are according to need, and that but do not stigmatise. So this is one of the aspects of thinking about proportionate universalism. And Michael Marmot certainly developed a view on this out of his work on social determinants of health, that proportionate universalism in the health field was needed. And so our thinking is applying that in this area as well.
And I guess the final point we were thinking is a kind of a framework or a way to inform a whole of government approach to enabling people to thrive in their community rather than end up in prison. So I guess we've seen some really interesting work. It's kind of taken wings and gone off in different directions, this. But there was a really interesting bit of work around, like, the New South Wales Deputy Coroner referring to this work in a decision about the death of an Aboriginal man on parole. So she was kind of talking about, Eileen, did you want to talk a bit about, because I know you had that discussion with the Deputy Coroner.
Yeah, so I gave expert evidence at this coronial inquiry, and I presented this work around the social determinants of justice. And the Deputy Coroner said this had been sort of a light bulb moment, if I can put it that way, for her, having put it together as we have done in this framework, because every single aspect that we have in our social determinants and causes of causes applied to this young man. And it meant that she, like many coroners, wrote a terrific report. Many coroners are structural in the way in which they address what has been going on for someone who has died, particularly in the justice area. And so she said, look, this would be fantastic. We should all be aware of this modelling and this framework, because it gives us an insight into not just the individual causes, not just the fact that this person has drug use issues, or that a parole officer failed in their duty, because those are not what propelled this young man into criminal justice and all of the aspects that we've just talked about, and which led to his death.
I've seen it quoted by various people in different submissions to government too, so being used in that sense. The Justice Reform Initiative have been drawing on it as a way to advocate, again, for the kind of whole of government response that they're seeking in their work. So I guess they spend lots of time talking to the Attorney General and Minister for Corrections and Justice, and they're saying, well, actually, we need portfolios of those responsible for health, for education, for disability to also be engaging in in kind of thinking through the criminalisation of so many different groups. And actually, if we genuinely, their mission is a reduction of the prison population by half by 2030. And they're saying if we've got a whole lot of people who have said, yes, that's absolutely what we want to see. So we need genuine engagement by those working in different areas of government. We've had invitations from within government to talk about this work, and certainly resonance seen by many people working in programs who themselves struggle with being silent in a certain area. So we've seen it used internally within government agencies to try and shift practice. And I guess we also had done a few presentations, and one of those was in a group with New South Wales, where someone was saying, look, this would be really valuable also for magistrates around sentencing guidelines too, and thinking about that. And from a research perspective, I guess we've been thinking about different ways that this work can be further developed. So as Eileen mentioned, I have the great privilege of being involved with the Darrawah Elders Group in Walgett, who were, along with the Walgett Aboriginal Medical Service, were partners in the initial research that Eileen mentioned, that ARC linkage study. And I might just stop sharing. And that work, I suppose, was very much the recommendations from it, which had a qualitative component, but also the analysis of this data bank. The recommendations from that were really about self-determination and about holistic community-led solutions. And so when we went to report back on that research to the Elders Group, as we did in other communities, there was a really interesting response where they're a group who have been very involved in research and advocacy over many years. And they said, as at the end of it, this is fantastic. This is the kind of thing we've been saying for many years to government. We've been really keen to work differently, but they don't necessarily listen to us, but they might listen to you as researchers. And we thought, oh, isn't that fantastic that people think government listens to researchers, but also said, you know, this is, and they kind of invited UNSW or those of us working as part of this research to work with them longer term around building those solutions. And so that's led to this really fantastic long-term partnership because, you know, we talk about silos, universities also work in silos, and we were in criminology at that point, but the partnership is now cross-faculty, cross-uni, multidisciplinary. We have water engineers and solar engineers and ecologists and colleagues working in law, but equally in public health and food security, because so many of the factors, I suppose, that the elders identified as structural, and this work really resonates for them, outside of the justice system. So certainly, yes, that shift in policing that is needed and is a focus of that work, but there's all sorts of other drivers of disadvantage and discrimination that they identify that need to shift. So that work has been really interesting, and it's a good place to kind of sense test this kind of work. And so the social determinants of justice, the elders group have really adopted around work they're doing with children and young people. And so in designing a new kind of youth wellbeing service, which attempts to kind of support children and young people who are coming into contact with police, instead meeting you know, kind of a whole lot of unmet disability and mental health needs, but also thinking about housing options. So there's a Wiradjuri architect who is part of our team who's thinking about actually designed accommodation to support young people who are otherwise not being released on, you know, they're ending up in custody on remand because there's not suitable housing, or there's actually just a shortage of housing generally. And this is a cohort for whom specific accommodation designed to meet their needs that's staffed by people locally, and that the service itself is one that could be 24 hours, hopefully over time with proper resourcing, so that actually if someone's in crisis or there's a real challenge, that they can be the front line. And so even if it is police who are initially called, you're actually saying to police, this is a young person who needs help. You're calling, you know, the staff who themselves are Aboriginal community members who are able to de-escalate and provide the support that's needed. So it's kind of it's sort of developing as a bit of a proof of concept around that work in practice. But obviously the research that would be great to do is looking at other cohorts or looking at bigger numbers of people over time as well. But I suppose so much of the time as researchers, we like to say more research is needed, and that's certainly the case. I guess in this work, we feel like actually part of its value is people being able to take it up now in terms of what resonates and what is useful to them in thinking about applying it to their work, whether that's policy research, advocacy, service delivery, etc. I think it's also valuable in terms of evaluation, particularly of place-based initiatives, which is a very strong focus for the current Commonwealth government and a lot of Aboriginal communities. But to also say, let's not replicate what we know are issues, which is that unless you're dealing with all of the kind of structural factors or social determinants of someone's contact with justice systems, let's not set this up to fail when there could be really great elements of that work, but actually what's needed is more resourcing or a different focus of that resourcing. So yeah, I guess that's sort of a bit of the work to date. Eileen, I don't know if you wanted to add anything to that or open up for questions or particular points people would like to discuss.
I think it'd be great if anyone has any comments or questions. I noticed, James, that you've noted the New Zealand Royal Commission of Inquiry into Abuse in care, or the same out-of-home care. I imagine we'll have a look at that. I imagine that is highly pertinent.
Yeah, I just thought I'd put that in the comments.
It's great.
You were mentioning about that, because I think, one of the points about victimization against people who wind up justice involved is really, it's really pertinent. And I guess New Zealand is trying to reverse that, but at the same time, there's still a lot of stuff happening for our adults that find themselves in places of detention, which is probably pretty re-traumatizing as well. So we might not yet be learning from the mistakes of the past, but anyway.
Yeah, look, I thoroughly agree, and I think probably most people on the call, and particularly I would imagine Stuart, having started his work in Queensland, horrified at the watch house revelations of kids, particularly First Nations kids with disability, being held in watch houses in Queensland and being abused, being shockingly treated. So Ruth and I wrote a paper a little while ago reflecting some of that in the Northern Territory with all of the same factors around what was happening in Dondale, which it was and sadly still is a youth detention centre in Northern Territory. And so I think the more we can pull out information from things like that Royal Commission in New Zealand to continue to underpin or to challenge. I mean, we as researchers, of course, we all want to try and ensure that if something needs proof, further proof of concept, that we be challenged over it. So that would be great. And just a final thing, if those of you who have already looked at the Disability Royal Commission's reports, their report, particularly in the justice area, and it sort of linked in with the health area, reflected all of this and reflected the lack of equitable treatment and fair and just treatment for people with disability, particularly people with cognitive disability and mental health issues who have all of those other factors. So questions or comments?
Eileen and Ruth, I'll steal the opportunity as chair to throw in a question if I may. And look, thank you for a fantastic presentation. For me, it was really helpful because it provides a framework that you seem to do a great job of articulating a whole lot of concepts that have been bouncing around in my head, and you've stitched it together. And it's nice to see how the health part of this picture fits in within that framework. There's a US public health guy, Mike Ross, who used this phrase, the sedimentation of disease, which I don't particularly like, but it's unfortunately quite apt to talk about this concentration of health burden in custodial settings, and therefore the upstream is clearly where we need to go. I suppose my question after all that rambling would be, you made reference to silos, but the necessity of whole of government responses to address complex needs so that they don't result in people ending up in the justice system. How do we do that? It just seems to be one of the most wicked problems to try to get different government silos and departments to actually work together in a preventive way.
I'll just say a couple of things, but then hand over to Ruth because this is an area Ruth's doing a lot of work in. I don't know how many of you saw about 2 or 3 months ago that the Minister for Disability, Bill Shorten, popped his head up and said, well, the NDIS should not be funding criminals, people who are in prison and getting out of prison. They should not be getting an NDIS service, even though they might have been assessed as appropriately needing that service. So it is, we're in a big argument with him at the moment, some of us who are in this particular area of justice disability, and it's about siloing, because what the Commonwealth and what Shorten is doing is saying that criminal justice is states' business. We should not be involved in that, and so this is cost shifting to the NDIS to be doing, saying this person needs an NDIS package. So it's very alive and well, and with some very perverse outcomes at the moment with a number of areas, including the stuff in Queensland and the stuff with Shorten and so on. But over to you, Ruth.
I mean, it is a perennial question. I think it's a bit of the things that I can see being mildly and increasingly effective are at a multi-pronged level. So some of it is that higher level advocacy work. So organisations like JRI making that case and finding champions that are not the Attorney General or Minister for Justice for that. but, you know, Communities and Justice or Attorney General or actually the Treasurer. Like that's a big focus, I think, because as Eileen mentioned, we've been able to use this data bank to do economic analyses and cost benefit analyses over time for early intervention or diversionary support. One of the things is that the budgets are held often by those agencies separately. So you can kind of see, I mean, some of the analysis that we did showed that a lot of people who were in this cohort weren't receiving, for example, Centrelink benefits to which they were entitled for all of the reasons we know. It's really difficult for people in terms of documentation or homelessness, etc. But there's a kind of cost shifting from the Commonwealth to the state that was happening where people were being managed, again, in inverted commas, by police, by homelessness services in emergency hospital departments, rather than actually having stable, supported environments. And so that kind of drawing attention to that cost shifting can be very helpful because it arms different government agencies, including police and corrections, with arguments to say, I mean, they are very unlikely to say, give us less money, but actually for a shift in the way that resourcing happens. So I think Treasury is a really good focus of that work, and having this leadership, like champions within government that aren't seen as the usual suspects, I think is incredibly helpful. So I think it's partly advocacy and certainly I think, you know, Mindy Satiri from the Justice Reform Initiative says she can see this is incredible value in that sense, where you're actually talking about potentially saving money, because we know, I mean, we've been saying it for many, many years, Eileen, haven't we, in terms of there's nothing really more expensive, particularly around young people, than that kind of management by the justice system. It's it's millions of, and we did an analysis of one young woman, a young Aboriginal woman, we knew as Casey, we de-identified, but created a kind of analysed her life cost data in terms of her mother went to police in the first instance asking for help, was really struggling with her at about the age of 12, and she was out at night, not going to school, etc. And her mum was like, well, there is no one else that can help me. Went to police to help bring her home. But then absolutely, that just led to this process of criminalisation. And she was the kind of, by 21, she was the $6 million young woman. So we kind of, I guess those economic arguments work to a point around that. But I guess the other thing I've seen be quite effective is working with people at a certain level of government. You know, some of those mechanisms, the kind of cross-government agencies or mechanisms or committees that exist, and influencing practice there can be quite valuable. So I've seen a few examples of that too. But also, I guess, the work with the community in Walgett, where you're actually developing a proof of concept, where you're working locally in a way that is meaningful to support the unmet needs of, say, young people in that community. And then you can kind of make the case for that. So I guess it's good evaluation and documentation and analysis and support for those models. So those of us, I guess, in research roles can really assist with that, because you can kind of demonstrate there and bring along people, police, youth justice, you know, and others working locally, where they can see the benefit of it. Because if you ask police locally, they say, well, we don't want to be picking up these kids and keeping them in the police station overnight. We're often looking for somewhere safe to drop them home to. We don't want to be doing this work either. So you can actually shift practice locally, which then provides a really good model. And then those people, you know, we had a really fantastic commander in Walgett for some time who also worked in Burke, Greg Moore, who many of you may have heard of if you're involved in this area, who then got moved to Nowra because he's one of those kind of really valuable leaders who absolutely saw his role as you know, not having police involved in things that were not, you know, frontline police matters. And he certainly worked very closely with community leaders to shift that. So it's a bit of a combination, I think, of all of those things.
Yeah, thanks. And it sounds like one of the takeaways there for me is that place-based initiatives, which are where we need to be going, are a nice vehicle for showing the importance of working across government silos, because people in places are what they are. They're not siloed. I'm looking at Cameron Russell's face. I know Cameron's PhD aligns quite well with this. So sorry to put you on the spot, Cameron. Any reflections on that in terms of the work that you're doing around GIRAD initiatives?
I must admit, I just came in the last 20 minutes because I'm at a seminar at the moment, but I was going left foot, right foot, waiting to get out. Yes, when you say whole of government, I guess if it can be extended to levels of government, that seems to be essential. And I think you may have all been touching on that, but the practice is it's very difficult. So yeah, that's all I could say.
By the way, Stuart, I see Jackie and Amanda's got a hand up, but Jackie has asked about women. Indeed, we have done some very specific work around women. It's an area that Ruth has been directly involved with as well. One of the things that the social determinants shows for women, in all of our analyses, Aboriginal women were by far the worst off of everyone, men, women, other women. And that, of course, has that extension, particularly around violence in their lives. And so presenting this kind of approach of thinking about the social determinants which need to be addressed to support those women is, there are some small examples going on in New South Wales at the moment. For example, an organisation called WageAct, the Women and Girls Emergency Centre, is trialling a program for bail and post-release, which tries to address all of those, including the issues around their children, which is a major factor.
Thanks, Eileen. Amanda, I think you may get the last question.
I'll probably run out of time, but thank you so much, Eileen and Ruth. I work in Victoria. I'm in Justice Health and the director of the Aboriginal Health Unit. And there's a really big conversation happening in corrections at the moment about what we can do for people with disability or cognitive impairment with NDIS changes or proposed changes, etc. The challenge we have is that we're very, very, very resource constrained in correctional health and in corrections. And so we're trying to think about what we can do in custodial health and corrections for people. Our worry is that if you invest in more assessments through neuropsychs, people end up with a plan or some sort of assessment, but we've got nothing to give them in custody. Another thing I'm doing is designing an ACCHO-led model of healthcare in a prison. It's going to be a prototype. I think there are opportunities there for the Aboriginal people in prison. But again, it's about where do you make impact if you've got nothing to give them inside? Do you have any, quick reflections in a minute on that?
Well, look, if Victoria hasn't got it, no one else is going to have it, to be honest. But this is the point to be made that we have been trying to make with this kind of analysis and it's not corrections. I mean, corrections, it should not be the lead on this.
Yeah.
The police shouldn't be the lead on it. Of course, it should be social services and health and housing and education and so on. So one of the things that a group of us are trying to do at the moment, particularly around women, using this kind of model, is we're pulling together a parliamentary roundtable to try to lay out for the key ministers and a couple of the key secretaries of departments to lay these things out so that they can see quite clearly it's to your advantage to ensure that these resources are available in the community and in a culturally and disability and trauma safe way, because that in the end will save you so much, not just, of course, money, but others as well. And it also addresses everything that Australia says or the states have signed up to in terms of human rights. So I don't have any sort of light bulb things to give you, and Ruth and I have struggled with this for a very long time. So resourcing is absolutely vital. One of the things that I think will be really interesting for Australia to watch is whether or not the changes in the UK that are happening around criminal justice areas with the new government, there is a big commitment to get a third of people out of prison, within a few months, and to provide resources in the community for those people who, shouldn't be there in the first place, but for those who are going to end up in prison, to ensure that there is a pathway out and a supported pathway out. And it's covering all of the things that we've just talked about. So I'm going to be very interested in watching how that goes.